Welcome to today's webinar series entitled Getting Reimbursed, Updates on Billing and Documentation for Health Behavior Assessment and Intervention Services in 2020. Our presenters today are Dr. Stephen Gillespie, APA's Senior Director of Healthcare Financing, and Ms. Megan Dugan-Haas, APA's Coding and Payment Policy Officer. This webinar series has been pre-recorded and broken down into segments to make it easier for you to understand and refer back to. Our objectives are to understand the H&B code set review and revision process, to introduce the 2020 Health Behavior Assessment and Intervention Services, and we'll review the new CPT codes, descriptions, and coding structure, as well as provide an explanation of how the existing codes crosswalk to the new codes. We'll also apply the new codes using clinical examples and review coding guidelines, payment policies, and reimbursement values. In this section, our presenters will provide an overview of the Health and Behavior Review and Revision process.
Thank you everyone for joining us today. We will begin by going over the H&B code set as well as the review and revision process. The H&B codes as they exist today were first implemented in calendar year 2002. Then, as part of a typical periodic review of existing codes performed by CMS and the AMA RUC to ensure that the codes are up to date and reflect clinical practice, the H&B code set were discussed in April 2018. During that discussion, it was determined that the entire family of H&B services should be reviewed and revised. During the revision process, APA proposed to restructure part of the code set to a base and add-on code structure, which is typical for timed services. APA then resurveyed the entire new code set and presented updated recommendations to the RUC in January 2019.
In regards to the purpose for the revisions to the H&B codes, there are two primary reasons. The first reason was we revised the codes to more accurately capture and reflect current clinical practice. The second driver for the revisions was we wanted to capture the greater emphasis on interdisciplinary care and teamwork with healthcare providers in both primary care settings and specialty care settings.
Therefore, the existing codes 96150 through 96155 will be deleted come January 1, 2020. Additionally, they will be replaced with a new family of Health Behavior Assessment and Intervention codes. The new family of codes include an extensive number of changes, such as changing from a timed to untimed service for assessment services, the new base and add-on coding structure for the intervention services, updated units of time for reporting the intervention services, as well as updated work relative value units, which are used to calculate reimbursement. We will review all of these changes in detail throughout the modules of this webinar.
In this next section, our presenters will share with you some resources for the 2020 Health Behavior Assessment and Intervention Code family.
Throughout this webinar series, we have reviewed all of the new CPT codes, the code descriptors, the RVU values, as well as the crosswalks for reporting the new HBAI services beginning on January 1, 2020. For your convenience, all of this information has been compiled into their own individual resources and are found on the reimbursement section of the APA website. That website is above the first link reported. We strongly encourage you to go and visit this site, download these resources, and begin familiarizing yourself as well as your staff with the new codes so that you're fully prepared to implement the new code set come January 1.
In addition to the current resources that we have available, we will be producing additional publications, new information and resources to assist you and your staff with making the transition and implementing the new HBAI codes that will go into effect in January. So specifically, one resource that is under development and will be coming your way in the near future, we are developing a health behavior assessment intervention billing and coding guide. This will be similar to the guide that was developed for the psychological testing and neuropsychological testing services. So we're in the midst of developing that, and we'll get that out and available. That will be available to not only members, but we'll also make that available to payers as well. Additionally, after the webinar and as questions start to come in, we will do, we'll have frequently asked questions and we'll respond to that, as well as additional resources will be forthcoming.
Thank you for viewing our webinar series on the new HBAI family of codes. And thank you to our presenters for sharing this important information to help us all prepare for 2020. HBAI Services, Inc. is available to help members with any health insurance or managed care issues, whether this involves private or government insurers. For issues related to billing codes and Medicare, or any questions regarding the content of this webinar series, please contact the Office of Healthcare Finance at ohcf@apa.org. For issues with Medicaid or private insurers, please contact the Office of Legal and Regulatory Affairs at praclegal@apa.org. If you are unsure of who to direct your questions to, you can also reach out to the Office of Healthcare Finance, and they will help direct you to the right person. Thank you, and have a great day.